I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's video is called Look It Up Before You Worry, Hear About Surgery Costs. I wanted to tell a brief story about one of my clients. This person had some time to go in high school yet, and they wouldn't turn 18 for about a year and a half. My patient was male identified and dearly wanted to start testosterone and to get gender-affirming top surgery. Now, in case you don't know, top surgery is a type of reconstructive surgery that will create a male-appearing chest. It doesn't simply create smaller-appearing, but still feminine-looking breasts. So it really does make a huge difference in a trans male's appearance. And I'll have lots more about this in a later video. So getting back to my client, their parents were not in favor of this kid having either hormones or surgery. And I have seen a number of young people in this predicament. So I assured the client by stating the best I could, there's no question in my mind that you're going to be getting top surgery and testosterone. But unless your parents have a change of heart, it's going to have to happen when you don't need their consent at age 18. I explained that I knew that this would feel like forever, and I recommended that they start looking at surgeons' websites so that they could be as well informed and as well prepared as they could be. My patient expressed great concern about the cost of top surgery, and it would probably be somewhere in the neighborhood of about $10,000. What if I can't save up that much money, they asked. Well, this is where I can make a difference with real information. I informed my patient that top surgery was generally covered by his family's insurance plan. And if for some reason I explained to my patient that top surgery was generally covered by the family's insurance plan, and they could also get their own job, even part-time, where they themselves would have their own health insurance to cover the expenses. We talked further, and I explained that a young person can generally be covered by their family's health insurance up through age 25, that is, until they become 26. In the Seattle area, many employers have long since offered health insurance that covers the bulk of expenses of gender-affirming surgeries. In our area, for example, we have many people who work at Amazon, Facebook, Microsoft, or Google. In addition, there are many large companies like Boeing and Starbucks and the University of Washington that also cover the majority of surgical costs. Even people with lower cost insurance, because they are on state or federal support, generally have appropriate benefits. But you really must check this out for yourself. In our medical office, we recommend that policyholders inquire about their insurance coverage directly. And a more useful suggestion is to save yourself time and frustration by asking for the insurance company representative who is knowledgeable about transgender and gender-affirming health benefits. You really must ask. Some employers have several different plans that are underwritten by the same insurance company. And after all, trans medicine is quite specialized, so talk to a representative to know for sure. I also assured the patient that it wasn't uncommon to see parents changing their minds about consenting to gender-affirming surgery. Would that happen for this patient? No way to tell, of course. But this way, the patient would be able to get as much helpful information as possible and to be prepared to act on that information sooner if their parents agreed. If you found this little video helpful, please like it, share it with somebody else who might need it, and subscribe to my channel. Thank you for watching, and I'll see you in the next video.